One of the questions I get asked all the time as a family doctor is, how did I start to become a trauma therapist? And the answer kind of starts in a professional way, but in my global health work. So I was running a health equity residency, doing a lot of overseas academic consulting in 2015. And I was working at the Patton Academy of Health Sciences, which is a medical school in Nepal, when the earthquake hit. And I got evacuated to Singapore after 3 days, which was more than 30 earthquakes later. And I had a lot of nervous system stuck responses at that point. So, in the hotel I was staying at, every time the garage door would go up, I would feel something in my body. It was really triggering. And I went to see a psychiatrist, and he said to me, "Well, you're having a normal response to an abnormal situation." And I just started thinking about trauma. What is it? How is it happening to me? And how does it happen to the folks that I serve as a physician without recognizing it? So this took me really deep down a rabbit hole. Once I started studying trauma responses, I got into things like epigenetics, or how trauma is inherited, polyvagal theory, or how does it show up in our nervous system, and the ACEs, so adverse childhood experiences. And I will do separate videos on all of these topics, but these are the kinds of things that I did not learn in medical school. And I wondered, well, what else have I not learned in medical school? And I really wanted to understand, how do I treat trauma? Because once I started to recognize it, I could see that it was affecting not just my patients' mental health, but their physical and their social health as well. And there's great evidence that this is true. So I just started studying so many different kinds of therapies, because when I go down a rabbit hole, I go hard. So I love body-based therapy, because when you don't necessarily have a language for what happened to you, and when your nervous system is hijacked by your amygdalas and you can't really use your thinking brain easily, the body is a wonderful doorway to try to access a place of calm and peace. So I've studied things like soothing touch and tapping. I've studied tremoring, brain spotting, deep brain reorienting, all kinds of specific therapies and emotional regulation techniques. So some of these have great scientific evidence in clinical trials, and others of these are really just nervous system hacks. So I've been spreading the word on these for a really long time. And it's not that I haven't studied cognitive therapies. I've studied CBT, cognitive behavior therapy, DBT, dialectical behavior therapy, ACT, acceptance commitment therapy, a little bit of internal family systems. The one I really love is called NARM, or the Neuroaffective Relational Model. That is a beautiful way to manage complex and childhood trauma. So there's all kinds of tools in my toolkit. And what I want to do is to bring these tools not just to the patients that I see, but to the general public. So what of these things can you learn more about, so you can figure out, well, what's happening in my nervous system and what can I do about it? Because there is so much that can be done. The last important thing about trauma is, once you've studied anything about it, a lot of people worry that, well, once I've been through trauma, it makes permanent changes in my brain. And that is what the research on things like ACEs, or adverse childhood experiences, shows, is it affects all of your later in life health issues, including longevity or your life expectancy. But what people don't understand is how much of this is reversible through neuroplasticity. So our brains are constantly changing. And the good news about trauma and toxic stress is, the more that we learn, the more that we teach kids about this, like, so parents, teachers, the more that we interact with the public in a way that is trauma informed, the more that we're going to have just this collective knowing of what to do about trauma. And I'm super excited to participate in that.